Hi, my name is Eileen Hsich, and I'm a member of the HFSA Communications Committee. We have selected Dr. John Teerlink's presentation as one of our most important presentations at this meeting today. And I'm looking forward to you telling me about it, but first I actually want you to share who you are, where you work, and what your role is at your institution.
Fantastic, thanks. It's a great honor to be here. I love being at the HFSA, and I'm Dr. John Teerlink. I work at the University of California, San Francisco as professor of medicine, but all my clinical work is at the San Francisco VA Medical Center, where I direct the heart failure program as well as the clinical echocardiography laboratory. So,
Wonderful,
yeah.
Wonderful. So tell me the highlights of your presentation today that really was amazing.
So one of the things I think is really interesting is for over 100 years now, we've been trying to find drugs to help improve the cardiac performance. And unfortunately, all of those drugs that have been used so far are of a class that we are now calling calcitropes. And calcitropes are agents that improve the cardiac function by increasing intracellular calcium. And these include things that we use every day, like epinephrine, norepinephrine, dobutamine, and the phosphodiesterase inhibitors, mostly milrinone here in the States. And these agents will cause increased myocardial oxygen demand, arrhythmias and ischemia, and death. And that very adverse effects are directly linked to their beneficial effects. So one of the purposes of this development program of omecamtiv mecarbil has been to develop a myotrope, so an agent that improves cardiac performance by directly acting on the cardiac sarcomere. And by that direct activity, it avoids all of the adverse effects, or we think it avoids all the adverse effects of what we call now calcitropes. So that was the original kind of therapeutic hypothesis, if you will. And it goes back to the idea that if the initial insult in heart failure with reduced ejection fraction is systolic dysfunction, and everything triggers from that. So far, all of our neurohormonal antagonist therapy and everything works downstream from that. It doesn't actually directly get to the main fundamental problem, which is the decreased systolic function. So our hypothesis was that if we could find a way to improve cardiac function directly, then it would decrease all of those downstream signalings directly, and we would have a chance to see actual reverse remodeling and improvement in cardiac function, which might translate into improved survival. So that's the hypothesis.
And along those lines, I think that what I really was impressed with was that not only did the ejection fraction go up, which is what I would have expected, but as you just said, you actually did see LV decrease in dimension and size. Is that correct?
Right. Yes. No. So you're absolutely right. We saw through omecamtiv mecarbil, which works directly on the myosin head, it directly can improve cardiac performance. But through the 20 weeks of oral therapy, we saw decreases in systolic dimensions and volumes, which, as you said, we kind of expect because it's increasing cardiac performance. But importantly, over those 20 weeks, we also saw progressive decreases in diastolic volumes, suggesting reverse cardiac remodeling. And associated with that, we also saw commensurate improvements in NT-proBNP.
That's right.
And in addition, we saw a decrease in heart rate. And omecamtiv mecarbil has no effects on the vasculature, on adrenergic signaling, or anything directly. So that, we believe, is reflective of actually sympathetic withdrawal that's in response to this improved cardiac function. So because of this, we've taken that study was the COSMIC-HF study, and that was about 150 people in the groups. We've now gone forward with this to the GALACTIC-HF trial, which is a traditional morbidity mortality outcomes trial, 8,200 patients. It's fully enrolled, and this trial has people with reduced ejection fraction, less than 35%, with symptomatic heart failure and some mildly elevated NT-proBNPs. And we've been following them for a while, and now we'll have to wait for events to accumulate and see what the results of the trial are.
We look forward to it.
Thank you. Thank you, Eileen. Great to talk to you.